I welcome our guest of honor and speaker for the day, Dr. S. Rajarajan, to proceed with this session. Sir, we request you take over the session.
Thank you very much, madam. It's a pleasure, absolute pleasure to be here amidst all of you and to talk about one of my favorite subjects, the digital transformation and disruption in healthcare. So, as you all know, we have come out of difficult times in the recent past with respect to healthcare, especially with respect to the COVID pandemic. We have seen how important health is, much above all other things. So, but during this period, we still, as a healthcare organizations, we are all not very organized sector. We are still an unorganized sector. A lot of gaps are there in for us to take into digital transformation and bring in disruption in healthcare. If you look at various disruptions like Amazon, Uber, those kind of disruptions, not much has happened in healthcare over the years. But during this pandemic, many things have happened. So we look at what had happened and how healthcare is now getting into this digital transformation phase and how disruptions are all being created in healthcare in today's session. It's going to be brief. I'm going to skim through some of the things and would recommend the participants to ask me any questions if they want to know in detail. My details are there in the presentation. I would also be sharing the presentation with the faculty members so that you could all have this presentation and refer this presentation and also share this presentation if required. Okay, so there goes my introduction. It's already done. So I take absolute pleasure in interacting with the student community. It makes us feel young and also brings in a lot many ideas per se. Today, I'm here at MGM Healthcare as the Chief Operating Officer. We are a 400-bed hospital with 30 plus departments and fantastic clinical team. We are one of the very few hospitals with NABH accreditation, JCI accreditation, and US Green Building Certificate LEEDs certification. We are also accredited certified for our NABH National Accreditation Board for Hospitals for our emergency services. We also have the halal medical friendly tourism certification from Halal India Board. So all this makes us as one of the premier choices for people. Yes, many of you would have seen the hospital. It looks more like an IT building or like a hotel building, but at heart, we are a hospital and our prices are well within the reach of common masses, comparable with any other good standard hospitals in the city or even in the country. Now, healthcare per se, if you see, you would actually, when we look at it, Indian healthcare is very, very unique. The earliest documented evidences of, various healthcare treatment were recorded in books like Charaka Samhita and Sushruta Samhita. Charaka Samhita records everything on the medicine level, Sushruta Samhita on the surgery and even plastic surgery level. Now, this was how ancient Indian healthcare systems were. And one of the proud moments is this was any other country, this was not well documented, but for India. Now, from there, over the years, what has happened is very many advancements, developments have come. So on the right-hand side of your screen, you would see the Da Vinci robotics system, which treats cancer with pencil beam therapies. We have the Da Vinci robotic surgical system, which could do surgeries through robotic arms, which ensures more grip, more finesse, and much more better outcome with respect to surgeries. So, as I said, we discussed about the pandemic briefly when I started. And yet there are decades where nothing happens and there are weeks where decades happen. It was told none other than by Lenin. a great time to quote somebody from Russia when Russia and Ukraine are at war. And over the years, nothing had happened, and within few weeks, everything happened. In fact, that week when Russia started war with Ukraine, we didn't know that Argentina would win the World Cup because they have been having some losses, and we didn't even know whether they would make it to the semis. We didn't know whether Pakistan would qualify for the T20 World Cup, but they emerged as winners again. So a lot of things happened that week, and so was the pandemic as well. Exactly 3-4 years back, around about the same time is when the full lockdown had started, and the pandemic revealed how vulnerable we were with respect to our value chains, with respect to setting our sights on strength, sustainability, and agility. So in all this, what happened was every industry trumped with digital innovation. Now we know how kids were taught, or even in colleges, people were taught. We call these batches as COVID academic batches. Okay. Online education or digital transformation was very, very transparent during this period because that was the only way to cope up to the requirements. So in healthcare, what has happened is we felt a direct need for sustainable digital health advancements, and there needs to be a roadmap for that so that we are better prepared for the future. Now, along with such a pandemic, or even much before, we have been living in this VUCA world 30, 40 years. So the world that we live in is highly volatile. We talk about this when it comes to, our share market. We've all been going gaga about a particular Gujarati-based company share when it was zooming past. And then suddenly in the last 1-2 months, it has been performing very badly due to certain reports, and we're all worried about it. So this is just brief example of volatility. So the ups and downs are so vivid and so fast that you will not be able to predict it. Uncertainty. There is a certain amount of uncertainty into the ways in which we need to deal with things. Complexity. It's not very simple. It's not very straight cut method. It's going to be a very complex, arduous way of achieving things. So, and then ambiguity. Options are plenty. What should I do? Whether I should go this side or go this side, whether I should specialize in HR or into marketing or into finance. So those kind of ambiguity, it's there with each of us in our own life. Now, how do we circumvent, or how do we mitigate the risk of this VUCA world? Is by having the VUCA prime, have a clear vision, have an understanding, have a clarity, have agile systems incorporated. So this VUCA prime would help us in our life, in our profession, in our career to move ahead. So coming back to healthcare, it all started as a science, started as home remedy, and also started very primitive. Even today, we talk of Party Vaidyam, which is primitive and which is a home remedy and stuff. And there are certain scientific aspects about things. And so also it was then transformed into focus areas changed into patient, people, process, and dealing with the present illness. So here the focus were more on affordability, availability. We are talking of 90s and 2000s when we were really looking at, how affordable healthcare systems were, how much of availability is there, how can one avail healthcare and stuff. The entire Northeast, it was very bad. 15, 20 years back, the access to healthcare. 20 years back, Bangalore didn't have so many hospitals. Chennai was still the healthcare capital of India. Now it has all changed. Increasing an aging population. India has a huge aging population, and also young population is also very high. In fact, it is touted, it is said that we would be surpassing China with respect to our population, especially even our young population. Value-based medicine. So value-based medicine was a keen this thing. professional staff. We were talking of nurse ratios, doctor ratios, and all these kind of things. Now, in the new normal that which we are living, you, me, and everybody are living today, we are looking at digital health. We're looking at technology transition. We're looking from moving models from capex based to opex based. Not to have capital intensive models is the need of the hour. We and even from OPEX based to transactional, wherein it is all the more paper use and things like that and stuff. Then we are also getting into artificial intelligence, machine learning, Internet of Things. So all these are the new age developments which are happening. Now, one such area, even in the introduction, they did talk about design thinking. So I teach design thinking as a full-fledged subject for Faculty of Management Studies at Ramachandra, wherein, and I have also been a speaker in various forums for design thinking. So design thinking is something which is very close to heart. Design thinking is there everywhere around us. We just fail to observe it. It is something that which we do it. We all know the plan, do, check, act cycle. So throw in a bit of empathy on from the user side of aspects. You have design thinking. This design thinking refers to the cognitive, strategic, and practical processes by which design concepts are developed. So, so literally any new initiative, you can apply design thinking. Any new process, you can apply design thinking. I'll give you a brief example of small design thinking project that we did. Our orthopedics patient, where the waiting area over there had low seated sofas, low height sofas. So that which required our orthopedic patients to bend their legs and sit, and they found difficult to get up. So this was brought out in one of the observational rounds. We all got together and we then procured, tall chairs, not really tall, but like a dining table chairs where the patients need not bend their legs. Rather, it would be a flat L-shaped comfort level. That which changed the way our OPD functioned and changed the way our orthopedic patients were complaining before, and later we didn't get any complaints of pain while they sit and get up from the waiting chairs. So this is a very small example. So, but anyway, with respect to design thinking, it's not a very new concept. It's been there from the 60s. There has been very many people who have worked on it, and the companies like Sheraton, MGR, Starbucks, Airbnb, Nike, Procter and Gamble, Netflix, Nexa, have all been using it. So somebody like the flag bearer of design thinking, as such as we know, was definitely the Apple guy, Steve Jobs. So who said design is not just what it looks like and feels like. Design is how it works. So that's what we look at in design thinking. Design thinking is the important catalyst to change an innovation or a new product into a disruptive phase. I told about Netflix. Netflix, when they started 90s, late 90s, early, before 2000, they went to a company called, you know, that was a video rental company, which they went to and asked whether they would be able to acquire them. So this video rental company was literally present everywhere in the US. Every city had this video rental company. Now, the video rental company turned them down. And they said who will watch streaming content at home and all stuff. Today what we all end up doing, Netflix and chill. And that video rental company is only having one nostalgic store at Times Square, and all other stores across USA has closed. Another good example is about the Kodak and Fuji. Kodak was a market leader, and they did not disrupt, or they did not use the design thinking concept to move into digital films. Now, whereas various other people who are not market leaders took up the digital films much earlier, like Fuji and others. So eventually, Kodak today is not even present uh, in the photography industry. Kodak Theatre is where the Oscar award happens, and Kodak factory, which was actually was used recently by the US government for producing COVID vaccines. So a disruptive technology is wherein there is high quality of use and most demanding use, and it keeps searing from there. So, even in healthcare, what happened was that telemedicine was a disruption when the COVID hit. Telemedicine has been there for 20 plus years in India. I'm a member of the Telemedicine Society of India. The TSI was started way back in the 1999 and 2000s. So, but today everybody knows about telemedicine. Even our parents know about telemedicine. Even our grandparents know about telemedicine. So that's because of the pandemic. That's because of the fear of moving out of the houses. We are forced to learn how to use telemedicine for our healthcare needs. Okay. So in healthcare, digital disruption is real. So if we are not going to look at it, it's going to be a smack on the face and we'll be knocked out. So if you look at again various other examples, you look at the music, the photography, the video rental we spoke about. Music, how many of you know about Napster? How many of you have heard of MP3s? Today we are all listening in Prime Music, Savin, what else, what not. But these were all not the things before. In 2005, the print media, the TV, travel, HR, everything has disrupted. In 2015, the retail, healthcare, automotive, education, telecom companies, food, FMCG, banking and insurance, they all took to digital disruption. 2025, one thing is for sure, all safe havens will be subject to disruption. So healthcare is already on the disruption highway. And it's true that we are fast transforming digitally and disruptions are going to be coming around just around the corners. Okay, so to understand what works, from the design thinking aspects, and to understand how it is going to be sustainable over a period of time, I would want to introduce a concept called the hype cycle. There are a lot of hype cycles. If you Google, you would be amazed to see various industry related hype cycle. So this is the digital health hype cycle of 2021. So they have classified, technology trigger, peak of exaggerated exceptions, trough of disillusionment, and path of enlightenment and plateau of productivity. Any product or service, digital product or service was kept in this different phases of this graph. Now, what happens is something of a promise or potential of an emerging technology in context of their industry. People take it to up to that. There is a high risk for some of the early adoption strategy. The technology trigger level, you can take up that kind of a product and stuff. If you want low risk, then you would go for a mature this thing. So you're looking at something in the plateau of productivity and stuff. Blockchain, blockchain is so famous now. How it is going to come into digital health? Now, yeah, crypto is being used as a ransomware to extract money, even with the recent Ames attack. And the very, very recent, 10 days back, we had a Sun Pharma attack. So in all this, they had used, ransomwares, and they're demanding in cryptocurrency, which uses the blockchain, which is one of the most secure way of transferring data without leaving a trace. So the same blockchain we would be using in the future for healthcare, data storage through NFTs. So NFTs are not just left to, your Kamala Hassan's, Rajinikanth's and Amitabh Bachchan. It is also going to be available for all our arm armies like us. Every Samanya Manidhar Ellarukkume, it's going to be available. And all our healthcare data, when it is stored in that, you can even decide whom you can share and whom you should not share. You can cut off your access levels. So the future, what is the future of healthcare hold? So we are moving towards wellness. There is a lot of isolation when it comes to pandemic. We are looking at doing a lot of preventive healthcare. Global health is of focus. Predictive health and personalized medicine are all being looked at big time for the future. Now, when we look at digital transformation journey, it is very important for each organization to understand which part of digital transformation journey they are at. First thing is the digitization, which is a conversion of analog to digital. That is, there is a paper-based medical record. You scan it and you keep it. It's digitized. Now, the next phase is the digitalization, wherein you provide softwares in which it is keyed in. And so it is a searchable tool for you whenever you require. So that is digitalization. The future is digital transformation, which happens with a collaboration with rapid process automation and various other things, which is going to create the value for digital from digitization and digitalization. Now, important things for change management and digital transformation is definitely having the right amount of awareness, the desire, the knowledge, the ability, and the reinforcement. In this, the awareness, desire, and knowledge phase is going to be the enablement zone, and the ability and reinforcement would become the engagement zone. Now, various, as I said earlier, these are some of the examples where huge disruption or digital transformation has happened in the recent past. We talked about telemedicine and telehealth, mobile health, fantastic tool, world in your at your palms. So this is something which is fast growing, and we saw how our Arogya Setu helped us during this disease outbreak tracking. So the next is chatbots, the interaction, the patient engagements. Phenomenal things are being done by companies with respect to chatbots and their usage, especially also in the healthcare industry. So we have the CRM and software modules, which helps understand, summarize dashboards, manage administrative response, scope for customization, cloud deployment, and whatnot. So the artificial intelligence and machine learning, that's another key reason for implementation, how you have to accept to digital transformation. We look at AR, VR, and MR. These are augmented reality, virtual reality, and mixed reality. So all these things are coming into shape, and you'd all be very excited in knowing what is happening with respect to all this, with respect to healthcare as such. So cloud computing, so many of the hospitals or many of the healthcare organizations have gone to cloud. They don't no more store on-premises data, much more secure, much more easier to do it, scalable over a period of time. Excuse me. Then the remote patient monitoring has been another phenomenal tool to understand, even when the patient is at home, of what is happening over there at your mobiles or even at the receiving side station at the doctor's clinic. So another area for ripe for disruption and already getting, making waves is the Internet of Medical Things. These are effortless vital monitors, effective continuous monitoring. So it's more based on wearables and sensors and reduced manual efforts. So again, RFID is a very low hanger when it comes to digital transformation, but could be a very useful workflow tool to enhance man-machine materials tracking, better waste and inventory management, and various other utilization. Last but not the least, 3D printing is yet another area where rapid strides gains have been made, and we are progressing towards a proper digital transformation, a very good disruption with respect to healthcare in all these areas. So now comes the big question. Now, whenever you guys, whenever you people get to organization, you'd be put to questions as to whether we should do this or not do this. So this is a summary of some of the question, the pebbles in a pathway. It's not boulders, but it's just pebbles in a pathway. What's the purpose or need at present to implement this new technology? There are so many software. How am I going to choose the best one? How should I charge my patients for this new service technology? Can I trust all the data derived from this technology? How should I draft the modules? Who actually need training and how often do they require training? I'll be getting immense data from the software. Where and how am I going to get storage? Who's liable if something goes wrong with this idea digital solution? Data security or privacy should not be a concern of my patient's employees. How can I assure it? How fast can I recover the cost incurred for implementing the digital solution? So these are all some of the questions which you need to ask yourself and answer before you take up some of the digital transformation projects in your career. Okay, so the universal health insurance is actually making transformation, making rapid transformations and signing up mandatory. So that which means we will be having a basic framework accessible to all. We will be doing data democratization, plugins for advanced applications and changes in medical and nursing team as well. So we have the government level bodies issued and we also have the other private parties issued and in this process and also we need the CSU support, the healthcare providers carrot and stick approach, the continual improvement, design thinking and service excellence. These are the ones which are eventually going to help healthcare professionals and provider organizations in furthering the cause on digital transformation. So this is nothing but the ABA ID. So I got an access much early during the sandbox phase. So this is my ABA ID. Back then it was called as the National Digital Health Mission ID. Now it's the ABA ID. So this is just a representation for you to understand what kind of disruption you could expect. Government is trying to integrate all the medical records of various hospitals and make it accessible and stuff. With respect to what we see in the front of the hospital is like the doctor app, the self-service kiosk, patient portal, the nurse calling systems, Alexa-enabled suite room automation, the CRM and call center solution. We use a tool called Amio, the porter management solution from Podzo, the HIS EMR, which is going to be the main backbone of our entire hospital operations IT system, is that, and you also have the ICU charting solution. This is all just part of what is that you will see at the front end. But to get it all in place, there are too many softwares, there are too many applications which you need to have, and too many departments, stakeholders, and all stuff. So this is something which is what was there at MGM Healthcare maybe a year back and things like that. So so this is how we are looking to disrupt healthcare to see how we can, at a very, very quick phase, make huge strides into digital transformation and especially more so into the various disruptions that which we want to achieve. Now, I have some book recommendations. So what got you here won't get you there. You're all young students. Academics is most important thing. And who knows, post this financial year or next financial year, you're all going to be placed and working in different organization. And believe me, whatever has got you there, what you hear won't get you there. And also understand purposes, how to do worthwhile work, and also with respect to making a difference. So if these two, three things are achieved, you'll be right there. And before I sign off, one of my favorite book, if Disney ran your hospital, 9.5 things that you would do differently. So this is a book which was a real eye opener for me. This man, Fred Lee, you can even check out his TEDx talk. I was very influenced by that talk and I have a presentation on that talk as well. But then today I thought that I'll talk about digital transformation, which would be more apt than a customer service management related topic. So before signing off, one other favorite quote of my mentor from whom I have taken this up and it goes like this: never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So wonderful line by Margaret Mead. She was an anthropologist. So fantastic to be living the world during these times, sharing this knowledge and resource with each of you at Dr. M.G.R. Medical University Faculty of Management Studies. So thank you very much. I'm open for questions now.
Dear participants, if you have any questions and queries, you can ask.
Good, good evening, sir.
Good evening.
This is Abhilash.
Yes, Mr. Abhilash, go ahead.
Yeah. With AI coming in, a lot of destruction will happen. And it is good on one end. The other end, we need to be prepared for the same. What, according to you, are the major challenges a healthcare professional will face in the next 5 years with AI kicking in, and how best can we prepare for the same?
So, answering to your question, first part of your question, next 5 years is going to be very exciting. There's a lot of technology disruptors which are getting imbibed into healthcare, and we need to embrace it and not push it away. So, I think it is going to be phenomenally changing. The landscape is going to change. We'd be having more organization in this sector per se. And AI, there are a lot of rules and regulations also coming in to regulate. So that is going to be one big disruption. We're just waiting around the corner for getting that in place. So that rule change is going to be of phenomenal push towards this AI, ML, and various other technology usage into healthcare. So having said that, your second part of the question was?
How best can we be prepared for the destruction which is going to come?
Yeah, so that depends upon your interest levels. So I still advise a lot of my friends or students to do a lot of things with respect to data management, data science, and analytics, so that they are better placed in the future for getting better career starts. Uh, so that would be my advice. So be on top of the game and get proper certification which are required for you to be making it to the top. Yeah.
Thanks, sir.
Thank you, Abhilash.
Dear participants, feedback form has been shared in the chat box. Kindly fill the form.
So this is Chitra Devi this side. As you talked about, many technology-based programs, technology-based solutions that could help in digital transformation. When, I read through many articles, and the people who are going to, bring the transformation really plays a vital role. Right. So, and especially when you talked about healthcare is in the unorganized sector. So what kind of a challenges, that you have come across, especially when it, to deal when you are dealing with people, and what are some of the learnings that if you could share, please? Thank you.
So I didn't go through this slide in detail, but the biggest challenge is resistance. We have this old doctor at the top. He's more comfortable signing off forms and writing off prescriptions rather than entering it into the system. Then we have, nurses who are experienced more on the bedside, but less on the system side. So they don't want to indulge into system data entry. Then you have seeking the proper solutions. We have the young and energetic doctors, administrators, moving around with iPads and tabs per se. So there is a lot of resistance. The acceptance is so different at a different level. So that's wherein I had given the ATKAR framework, which is which you need to place them on this framework. So based on the people level of awareness, their desire, their knowledge, their ability, we know whether we are still in a phase of very, very clear so that you can strategize for each of these zones. And believe me, it is not easy. Even the most seasoned of players find it most difficult bringing in the change. Change management is one difficult thing. You need to do a lot of strategic thinking on those and identify whether you're in enablement zone or engagement zone and suitably use the tools. Thank you.
Thank you, sir. I think you rightly touched upon, like, change. When it comes to change management, doing something differently, it is not always easy. And so that's why I just asked to understand how it has been done. Thank you, sir.
Thank you, Anne.
Hello, sir. This is Balmohan.
Yes, Dr.
My question is, how can we face the medical legal aspects arising? Because we have to preserve the records of all the medical importance, like indoor paper, outdoor paper. Even though we are making digitization and transforming the records digitally, we have to still preserve the records for medical legal aspects. So is it possible to totally convert or totally transform into digitization, and so that we can reduce the burden on maintaining the records manually in the future?
So, the government doesn't want you to store records. It's a very, misguided approach if we think that government is asking us to store all the paper records. In fact, today, more than private hospitals, all the government hospitals, the smaller, including the PHCs, community health centers, they are the ones who are scanning the records and keeping it in the cloud server. So we are looking at a very huge transformation over here, led from the government side. Private hospitals all would catch up. In fact, the government has invited private hospitals also to share data. The ultimate aim is to have data portability. Say somebody who has come into Apollo Hospital, later comes to MGM Healthcare, they need to access the data. And this control would be with the patient and not with the hospital. So that's what the government is trying to enable through this whole National Digital Health Mission or your Atal, the ABHM, the Digital Health Mission and stuff. So this is something which is going to phenomenally transform healthcare as such.
Oh, okay. Thank you, sir.
Thank you.
So this is Mukesh, sir.
Yeah, Mukesh.
So even though we are managing the data of different customers or the peoples, and how they are managing and gather the data in the portal and via telemedicine. So in future, it have any common platform, or how they are accessing from public to private hospitals to gather the data as much as earliest?
Yeah, see, today it's all very, divided. So that's what we are looking at, a very unique integration happening at, from the government initiated side. But if you look at, say, in our hospital, everything is integrated. We have our website. In website, we have the patient portal. We have open API views. We have our mobile app. we have opened API for the mobile app. Then we have a CRM, we have opened our API. So all these are the integration level tools that we are talking about. And in healthcare, it's like, nice patchwork of shirts, as I showed in one of the slides actually, the calm and the storm. So there are so many technologies which go at the back end for getting things done. So that answers your question.
Yes, sir. I this have the some questions, but even though in that the integration is not is full fledged.
Yeah, you see, integration is something which will never be full-fledged. So because what I wanted 6 months back would not be the same what I want now. We are living
Absolutely.
in the time of disruption. So a
Correct.
lot of demand is there. So according to those demands, we start serving people.
All right. Thank you, sir.
Thank you.
Dear participants, feedback from has been shared in the chat box. Kindly fill the form.
Sir,
So
this is
once
Chitra
again,
Devi.
yeah, go
Sorry,
ahead.
sir, just one question, sir.
Yeah, go
Like,
ahead.
in the organization, because I'm not into healthcare, but in a different setup. So in an organization, so normally when we talk about the digital transformation, if you wanted to get into it, which is the, is there any metrics or is there any, process to select, okay, which process to be done first, to consider for the digital transformation? So is there any guidance or guidelines are available with respect to that, sir?
No,
Like,
it's more on the prioritization and the organizational goals and the alignment with the organizational goals. So, there could be certain tools that which are available to help prioritize, but then I have not used any. For instance, when I was on the lookout for some of the HIS tools, HIS company way back in one of the earlier companies, I prepared a checklist. What are the minimum things that I would require? It is as simple as, like, say, for example, many of you are young students. So when you are going to sit for your placements, so you would be like having at least 3-4 points, right? So very small checklist or even a bigger checklist. The company should have a nice cafeteria is also there on some of the people checklist. The company should have work from home options. The company should have good maternity benefits. The company should have good perks and benefits. So all those kind of things, companies should offer salary even when I don't do job. So all those kind of things in different people checklist, it would be different. So no two people demand is the same. So, for digital transformation projects, it is always about the organizational requirement, the vision, the mission, the objectives that which needs to be achieved, and how it is aligned with this digital transformation process. So there's no one tool to say or prioritize, but common sense would help you as a guiding light in this.
thank you so much, sir. Thank you. Got it.
Thank you. Yeah, so that I think brings us to the end of the session. Thank you for having me over today digitally. I look forward to meeting you all in person. We're open to have you all come and visit MGM Healthcare, be part of us by starting as interns and then slowly progressing even as employees and patrons of MGM Healthcare. So it would be my heartfelt pleasure to invite the team to come over and be part of this successful journey of ours. And really enjoyed discussing with you. Very thoughtful questions. Hope I was able to do some amount of justice to all that I said. And the topic is very, very vast. It's not as simple to just teach. This could be an entire subject over a semester or even a PhD level thesis on digital innovations and transformation in, especially in healthcare, disruptions in healthcare. So thank you. Special thanks to Professor Dr. J.M. Madam for inviting me over. Special thanks to the management members for having me over. Thank you very much. Really appreciate the time and energy each of you have taken to be present for this session. Thanks.
Thank you, sir. Thank you for delivering a wonderful and informative session, and thank you for clarifying the doubts. And I thank everyone for participating in this wonderful session. Thank you. Good night.
Thank you very much. Thank you very much, sir.
Thank you, sir.
Thanks.
Thank you.
Thank you.
Thank you, sir.
Thank you very much, sir.
Thank you.